Thank you, Madam Speaker. Manitobans are finding tens of thousands of used hypodermic needles in neighbourhoods across the province, in parks, school grounds, parking lots, back lanes, even on buses. Our caucus recently met with a delegation of medical students who wanted to talk about harm reduction, and they told us that, quote, in 2018, the WRHA distributed 2 million needles at a cost of $430,000. This figure has increased 30 to 40% annually since 2013 in terms of demand. But while demand for needles has increased dramatically, harm reduction supply funding has not changed since 2014-15, remaining at $126,000. To make up this budget shortfall, funds were diverted from other public health programs such as upstream population health interventions. The Premier has often said it's better to offer a cup of coffee rather than a cold needle, but why is his government handing out 4 million cold needles at the expense of programs that would actually prevent addiction?
The Honourable Minister of Health, Seniors and Active Living.
Well, Madam Speaker, it almost sounds like the member is advocating for the reduction in harm mitigation strategies. I can assure all members of this House that the government continues to support harm mitigation strategies right across the province in places like downtown Winnipeg and suburban, in Brandon, in the areas of the north, and across wherever we have public health and primary care facilities. I can tell that member that there were more of those resources distributed last year than the year previous and the year previous to that. And that process will go on, important to make sure that people get the supplies that they require.
The Honourable Leader of the Second Opposition on a supplementary question.
Thank you, Madam Speaker. Manitoba Liberals have been calling for more than a year for funding for prevention, and we have called for harm reduction. The Virgo report, released over a year ago, calls for it throughout. The medical students who we met with pointed to a Canadian Institute of Health Research study that showed a, quote, lack of clear policy regarding harm reduction that has led to a stagnation in community harm reduction supports and puts Manitoba at least 8 years behind most other provinces, end quote. The evidence is that harm reduction is, quote, inexpensive, practical, safe, and has a positive impact on individual and community health. I table a government chart showing that STIs and bloodborne diseases are soaring in Manitoba. Does the Premier see that by opposing harm reduction, his government is increasing harm and is playing a role in soaring infection rates?
The Honourable Minister of Health, Seniors and Active Living.
Thank you, Madam Speaker. Members of our caucus were also pleased to meet with that group of medical students from the University of Manitoba to hear their presentation and hear about their concern, some of it from lived experience when it comes to addressing the important issues of addictions and mental health in our communities. I assure that member that harm reduction strategies continue to figure prominently in this government's approach in responding to what is obviously an increase, alarmingly, of illicit drugs in our communities, which has a devastating effect on families, on individuals' lives. We're taking action, and we will continue to take action.
Hear, hear.
The Honourable Leader of the Second Opposition on a final supplementary.
Thank you, Madam Speaker. We've often said that this government's response to the meth crisis has been like putting a Band-Aid on a broken leg. The Virgo report said, quote, current services and supports offered by the province are unable to meet growing demand, end quote. And that while, quote, Manitoba has the second highest prevalence of substance use disorders, it allocates much less to mental health and addictions, 5.1% of the provincial healthcare budget, instead of the Canadian average of 7.2%. Now, the Premier has been very creative in coming up with reasons for calling a snap election. One is he's complained that the 90-day advertising limit would affect Manitoba 150 celebrations. This government is part of a meth task force involving 3 levels of government whose work would effectively be suppressed by a publication ban prior to an election. I realize the Premier could simply ignore the 90-day ban the way he's ignoring a fixed date election, but what will happen to the work of the meth task force if the Premier calls an early election?
When's your nomination?
Order. The Honourable First Minister.
Madam Speaker, I don't ignore the issues that are important to Manitobans, but I will ignore that question because of the tone of it was disrespectful, inappropriate, and also contained a number of erroneous assertions. Thank you.